Did you know that many women are unaware of a silent condition that could affect their health? Vulval Intraepithelial Neoplasia, or VIN, often goes unnoticed, even by doctors. This article uncovers essential information about VIN, empowering you with knowledge to prevent treatment mishaps and ensure your well-being. VIN, or vulval intraepithelial neoplasia, it is not something patients usually know about, and even doctors are not extensively trained in this area. Many modern women remain unaware of this issue, leading to treatment mishaps. If your doctor has mentioned you have VIN, you will find a wealth of information here. During my time in England, I was involved in extensive research and writing on VIN. Here is a treasure trove of practical information explained in plain, everyday language. Symptoms. VIN can often remain silent without any symptoms for many years. It might only be spotted during a gynecological examination for another reason. However, some women may experience discomfort or itching in the vulva, which can persist despite treatment. Sometimes, scratching leads to nail marks. Gradually, the skin color may change, with the VIN area appearing different from the surrounding skin, perhaps whiter, browner, or reddish. Occasionally, the skin may seem raised or uneven compared to the surrounding areas. Since these spots are often hidden from usual visible area, monitoring these can become tricky. The problem remains out of sight. Nevertheless, with a little effort, women can check these areas using a small mirror. What is the vulva? Understanding this is crucial for grasping this article. The vulva is not the same as vagina. Simply put, the vulva is the area covered by skin between women's legs. The canal that leads from the vulva to the uterus is known as vagina. If you are surprised by this, I apologize. It's true that you won't find vulva mentioned even in many modern medical textbooks, let alone general ones. People often confuse the vulva with the vagina, but their treatments are entirely different. If you tell your doctor that you have a burning sensation in your vagina, the treatment will be different from if you have the same sensation in the vulva. So, to avoid treatment mishaps, some basic anatomy knowledge is essential. Why does VIN happen? Sometimes it happens without any reason, sometimes due to weakened immunity. It's more common among smokers and can be caused by pollution. Those with organ transplants or asthma treatments that suppress immunity, diabetes, rheumatoid arthritis, or other conditions that weaken the immune system are more likely to develop VIN. Conditions like lichen sclerosis and lichen planus can also lead to VIN if not treated properly. VIN is mainly classified into two groups. For the ease of patients and doctors, UVIN and DVIN. UVIN or usual VIN is influenced by a virus called HPV. DVIN or differentiated VIN occurs without the effect of a virus. Remember, it's impossible to differentiate these two types just by looking at it. They require microscopic examination. The names UVIN and DVIN might be a bit tricky to remember, so doctors often refer VIN as low grade or high grade, indicating how quickly the treatment should be administered, as high-grade VIN can turn into cancer more swiftly. Diagnosis. How is VIN diagnosed? The symptoms of VIN are similar to those of fungal infections, irritating from clothing or tight clothing rubbing against the skin. This similarity makes it difficult to diagnose VIN based solely on symptoms. However, identifying it is crucial as VIN requires different treatment and follow-up. Initially, a doctor may examine the area with a naked eye or a magnifying glass. Sometimes, a more powerful magnifying glass called a colposcope is used for vulvoscopy, which allows for a detailed examination of the skin. This procedure is painless and involves no cuts. In some cases, a saline solution or mild acetic acid or vinegar may be applied gently to check the area. Again, this causes no discomfort. However, for a more accurate diagnosis, a small skin sample might need to be examined under a microscope. Taking this skin sample involves using local anesthesia, and your doctor will explain the procedure if needed. Since VIN is linked to the HPV virus, If VIN is suspected, a pap smear and HPV test of the vagina and cervix are also recommended. These tests are not major surgeries and allow you to return home immediately afterward. At what age does VIN occur? For the longest time, there was a misconception that VIN only affected Caucasian women and was not really seen here. It is uncertain whether this was actually the case or if women were too embarrassed to talk to their doctors about it. Nowadays, awareness is growing. Across the globe, we are seeing more cases of this condition, and India is no exception. It was once believed that this problem only occurred in women over 60. While it's true that DVIN is still more common among older women, UVIN is increasingly affecting younger women. This issue peaks around adolescence and is most prevalent in women in their 40s. Certain conditions worldwide change dramatically over decades regarding their nature, the age they appear, or how they respond to treatment. VIN is one of those conditions. Therefore, staying aware and informed is crucial. With awareness, many future problems can be avoided. Complications from VIN. For the most part, VIN does not usually cause future problems. While VIN might not always be completely cured, it often remains just VIN throughout one's life. However, in a small number of cases, VIN may not stay confined to the skin and could spread to beneath the skin. This condition is known as precancer or even cancer, specifically vulval cancer. The good news is this progression does not happen overnight. With regular checkups and follow-ups, these complications can be avoided. If caught early, the treatment is highly effective and can help you return to your normal rhythm of life very soon. Treatment for VIN. The best approach for treating VIN is to remove the affected skin area, known as excisional treatment. If this procedure is necessary, it is carried out with utmost care to ensure the patient feels no pain. Thanks to advancements in medical science, such treatments are now possible without discomfort. However, the goal is always to avoid surgery if possible and opt for other treatment methods. The key to avoiding major surgery is early diagnosis and regular monitoring of VIN. In many cases, expectant management or regular follow-ups every 4 to 6 months or annually are sufficient. This involves checking the vulva to ensure VIN is not progressing. Additionally, a cream called imiquimod can be applied to the VIN area for treatment, and sometimes a medication called cidofovir is needed. A significant part of modern medical treatment is preventing the disease or prevention. This requires patients to be well informed. Some VIN cases are caused by a virus called HPV. Fortunately, the HPV vaccine is now available, reducing the likelihood of VIN in future for women who receive it. Although not all VIN cases are caused by HPV, the vaccine significantly reduces the risk of those that are. Although not all VIN cases are caused by HPV, the vaccine significantly reduces the risk for those that are. Link to the HPV vaccine video is below. Remember, prevention is better than cure, and staying informed and proactive is key. What does not treat VIN? Knowing what does not treat VIN is just as important. Antifungal medication. Many ask if antifungal medications can treat this condition. The short answer is no. While the symptoms might resemble those of fungal infections, they are entirely different conditions. Candida or fungal infections are common amongst women, and many use antifungal creams for itching. These creams might temporarily mask the symptoms due to their chemicals, but the symptoms tend to return. Intimate wash or vaginal wash. Will regular use of vulva or vaginal washes help prevent this condition? The answer is again no. Some research even suggests that regular use of such washes can reduce the number of friendly bacteria like lactobacillus in the vulva, potentially leading to other issues. So, it's best to avoid these washes. Dettol or other disinfectants. Should you use Dettol or other disinfectants or alcohol-based solutions? The answer is no. Using these solutions won't treat VIN and could cause other problems since the vulval skin is very sensitive. Anti-itch medications. Do anti-itch creams or tablets work? While these medications might help control symptoms, the true treatment of VIN involves more than just symptom management. It is crucial to monitor the condition to prevent it from turning into something more serious. Simply controlling the symptoms does not solve the problem, although it can provide temporary relief. Homeopathy, acupuncture, herbal medications, and diet. There is no concrete evidence in medical science to support the claim that these treatments can cure VIN. Relying on these treatments for too long can waste valuable time, and without proper treatment, VIN could worsen in future. If you are considering these treatments, discuss them with your doctor first. Role of alternative medicine. Since VIN is not caused by toxin, alternative medicine has no significant role in its treatment. Role of diet. Sometimes dietary changes can provide symptomatic relief, although they do not directly treat VIN. If your symptoms are resolved through diet changes, it is likely that was not VIN to begin with. Why caution is necessary? Women often experience discomfort, mild itching, and discharge in the vulva, which can be easy to overlook. However, if a problem persists despite treatment and keeps coming back, it's crucial to be cautious. Over a dozen skin conditions can mimic the symptoms of VIN or vulval intraepithelial neoplasia, making it essential to identify and differentiate them to ensure your future health is secure. Patient education plays a significant role here. Prevention is the key to managing VIN. With modern medical advancements, it is quite possible to prevent and control VIN effectively. On a related note, we have a study on unexplained vulval pain or vulvodynia. It is important to remember that vulvodynia and VIN are entirely different, but some symptoms may overlap. If you would like to know more about vulvodynia, click the link below. That's all today. We will see you soon over another video article.